Hello, Dr. Ferguson coming to you from the Passioncam. Today I'm just going to talk just a little bit about withdrawal using a drug called suboxone and what it's like when you get towards the end. A lot of my patients are very apprehensive when they get towards the end of their treatment. And I'm definitely not a believer that one needs to stay on such a drug for their entire life. The goal behind suboxone is to take away or to stop or to help with the withdrawal symptoms that are associated with long-term use of narcotics, such as the heroin, Percocets, Vicodins, opioids, things like that. Not crack cocaine, not cocaine. It doesn't work on those. So a lot of my patients get quite apprehensive as we wean them down, because we wean down in our program and we let everybody know on day one when they start that we will not be keeping them on this medication for life, but we will wean down. We'll wean down slowly. They won't be having symptoms as we wean down because we're going to wean slow. But the goal is to wean slow. So by the time we get down to the bottom dose, you're no longer having any physical symptoms. And the only symptoms at that point are usually the mental symptoms. The patient having a challenge with, how am I going to stop? Am I going to be okay? Well, I've done drugs for 10 years and I know, will I be okay without the drugs? And can I make it? Yes, you can make it. Yes, you can do it. But you have to do it correctly. You need to wean the program. You need to go slowly, so that you're weaning down, so that you can reduce the number of receptors that are associated with your needing more and more drug. You build up more and more receptors as you build up a tolerance. So what we're doing when we're detoxing is we're decreasing that so that you can sort of speak, get rid of the tolerance. So we kind of take you back down towards zero, but it's a slow process. But big keys, if you're going to be successful in any kind of withdrawal program, is that you got to replace that with something. So you need to replace those friends that were doing drugs with other friends. You need to get rid of those cell numbers of those that you had associated with doing drugs with numbers that aren't associated with doing drugs. You need to do some new activities that are going to take up your time in a different way. Whether it be sports, whether it be more time with your family, your children, whether it be taking up something new or different, another hobby. But you need to fill that idle space, that idle time that you would have been utilizing in the past to do drugs. All of those things are going to be helpful in helping you to move to the next level, helping you in this withdrawal process. But the bottom line, it comes down to when you have used the suboxone to the point where you're no longer going to have withdrawal symptoms if you don't take any type of narcotic, and we get our patients to that point. Now it becomes mental. You really got to decide right here upstairs that you're going to do it. And you have to make a decision, and make the decision in advance that you're going to be successful. That's one of the keys it takes to have success, is making the decision in advance. If you wait until you're right in the midst of it, you may not make the right decision. So if you make a decision in advance that you're going to be successful, and your why is big enough, why are you doing this? You're doing this because you want to have a better life. You don't want to waste the money you're wasting, because you've destroyed everything you love. Whatever your why is, your why has to be big enough to get you to do what you said you were going to do long after the good feeling you had when you said it is gone. Now that's critically important, that you have your why in place. You've got some new things in your life that will take up some of your time, some new people, new hobbies, etc. You've got a new set of friends that you're no longer hanging around. Those that did the drugs or associated with drugs are not part of your posse anymore, per se. And the combination of those things can help you be successful at the end of the road. Now, at the end of the road, you still have a choice. You can go back to doing drugs if you choose to. Nobody's going to stop you. Nobody's going to tie your hands together or tie your mouth together. But if you make a decision not to do it, you have the equipment, you have the what you need not to do, because you've already gone through the whole process. We've weaned you down from whatever dose we started. Now we're down at 2 milligrams, 1 milligram, and you've missed days intermittently, and you see that you didn't have symptoms on those days you missed. So you already have some ammunition to see that you can do less and less and less and less. And the only logical next position is to be done once you've done less, 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 and less. So, for all of you out there that are wondering, can you do it? Can you make it? Yes, you can make it. You definitely can. Is it going to be challenging? Yes, it'll be challenging. Do you need to be on suboxone the rest of your life? No, you don't. But you got to make a decision. You got to put some of these things we've talked about today in place. So on that note, Dr. Ferguson coming to you from his Passioncam, a little longer than usual, but we had a little more to say about suboxone. And for those of you who want more help in this category, you can go to the website, or you can go by the office. You can go lots of different places and find out more about just how you do how to get involved in such a program. And on that note, be blessed. Have a wonderful day. Dr. Ferguson coming to you from the Passioncam. Bye-bye.